I'm Dr. Malik, intensive care specialist. See, there is a small entity I wanted to discuss with you. Nowadays, not only nowadays, ever since my practice, most of the patients who come to me, some 50% of the patients, not all, they complain when I am checking their blood pressure, they say, I don't have high BP, I only have low BP. I don't have high BP, I only have low BP. When I check the blood pressure, their blood pressure is 140 by 100 or 130 by 100 or 140 by 110. Here, I want to tell you a small thing that what is hypertension? In fact, hypertension, hypotension, H-Y-P-E-R, hypertension means your BP is high. Hypotension, H-Y-P-O, means hypotension means your BP is low. When your BP is more than 140 by 90, we call it hypertension. When it is lesser than, when it is low, below 90 by 60, we call it hypotension or low BP. This is doctors generally. Low BP means your BP is very low, 90 by 60, you had some stun stroke or you may have loose motions, vomitings, whatever it is. Maybe you are having fever. With that, your fluids, body fluids have come down, your BP is low. Then we say you need fluids, you take rest, you take oral fluids, or I have to put some saline and all. This is what happens. But some patients, see, here I want to tell you one thing. This 140 is called systolic and 90 is called diastolic. Means 140 by 90 or 90-60. So 140 means systolic, 90 is diastolic. Here 90 is systolic, 60 is diastolic. This is what is upper one is systolic, lower one is diastolic. Some patients are confused. They say that when this lower one, they have 140 by 100 or 140 by 110, because they say that 140 is normal and the lower one, the diastolic, is raised. This is 100, this is 110. See, they are feeling that when this lower one, 140 is normal, they feel, and below there is 110 or 100, they say that my lower one is high, so I have low BP. This is wrong. Low BP means your total BP must be 90 by 60 or something like that. It should fall below 100. Both the things, it should fall below 100. But if you have 140 by 110, it is called hypertension only. It is called not low BP or hypotension. No. Low BP means your BP should be less than 100, that is 90 by 60 or 80-60, like that. But if you have 140 by 110 or 130 by 100, it is not low BP. What they are feeling is the lower one, forget about this, the lower one, if it is 110 or 100, if it is all, and in that case, the patient has always systolic, okay, 130 or 140, but the diastolic is always raised, the lower one is always raised, and that one is referred by the patient that I have low BP. No, this is not low BP, this is also high BP only. Please don't mistake like that. Low BP means your BP should be some 90-60 like that, or high BP means your BP should be more than 140 by 90. Only these two entities are there. Even in low BP, what patient refers to as 140 by 110, it is called only as a high BP only, and it needs medicines. You have to take medicine for it. Some people, they say, yes, I have low BP, I don't need medication. That is wrong. Your BP is high, 140, 110 means it is high. You have to take it. There is nothing like low BP, what the patient is thinking of. No, the lower one is high or the upper one is high, both are high BP only. Both are low, upper one, lower one is, both are low because of some disease or something, then we'll give some fluids or give rest and take oral fluids, whatever it is. So please understand this problem. Even if it is, if the so-called low BP patient comes to me with 140 by 100 or 140 by 110, I definitely put the patient on medication, one tablet per day.